Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
You're listening to Healthcare Matters, the podcast that pulls back the curtain to help you make sense of complex healthcare economics and policy issues. With us is Dr. Robert Popovian in Washington, D.C. He's a pharmacist, an economist, and the Chief Science Policy Officer at the Global Healthy Living Foundation.
Joining me is my good friend, as always, Ben Blanc from the heartland of America, Indianapolis, Indiana, and our Director of Digital Production and Engagement. Well, Ben, 7th season. It's good to be back.
It's good to be back, and can you believe it's actually the last week of January, and we already have so much to talk about? If anyone thought 2026 might be a slow year, think again. We've already seen updates to the U.S. childhood vaccine schedule earlier this month. In other news, Congress unveiled a bipartisan health bill and funding deal just last week.
And today's podcast, we're going to talk about flu activity in the United States, still elevated across the country. Hospitalizations, outpatient visits remain well above baseline. Flu-related deaths keep going up. It's a reminder that influenza is here to stay and remains a serious and ongoing public health issue. But, there are other communicable diseases. The pesky measles outbreaks that are currently happening across the country, most specifically recently in South Carolina. So lots to talk about, Ben.
Lots to talk about, and influenza is actually today's topic. Today we're unpacking a new economic study that you, Robert, and Dr. Wayne Winegarden co-authored. So let's get to it. And to tackle today's topic, we've got a special guest with us, Dr. Wayne Winegarden, Senior Fellow and Director of the Center for Medical Economics and Innovation at the Pacific Research Institute. Hi, Wayne. Thanks so much for joining us.
Hey, thanks so much for having me. Great to be here.
Today's episode is focused on something we don't often talk about clearly enough, the true cost of influenza. Not just in hospitalizations and lives lost, but in dollars, productivity, and missed opportunities for prevention. Seasonal flu activity remains high across the U.S., and that's why today we're diving into a new comprehensive economic study co-authored by Robert and Wayne. Together, we'll discuss what influenza really costs the U.S. economy and what higher adult vaccination rates could mean for lives saved and costs avoided. So, Robert, let's start by setting the foundation for this conversation. What did you and Wayne set out to measure in this study, and why was it important to look at influenza not just as a health problem, but as an economic one?
So both Wayne and I have done cost of illness type studies in the past on various disease areas. I know I have published in a couple of areas. One is community-acquired pneumonia, bronchitis. And when we got together, we started talking about how there's not been any new type of data coming out with regards to what is the burden of illness regarding influenza in the United States based on the most current data that we have available. So we decided to do a cost of illness study or an economic burden study, but with a twist. And the twist being, since we have access to CDC data regarding immunizations of adults concerning influenza, and also we have the outcomes related to flu, whether it is hospitalizations, mortality, morbidity, as well as time lost from work, that we would also assess what is the impact of immunization on patient outcomes of hospitalizations and mortality. So it's a two-pronged study that we both have had an interest for a while to do, and we just got some time end of last year to conduct this study. So it has both the burden of illness regarding flu, as well as what is the impact of immunization of flu vaccine on the burden of illness.
Yeah, and the numbers are striking. The study estimates that influenza cost the U.S. nearly $29 billion in the 2023-2024 season, with about $16 billion in medical costs and $13 billion in lost productivity. So where do those costs actually come from, and which groups bear them the most? Wayne, do you want to take this one?
I guess starting with the latter, which groups are harmed the most, and that's older Americans. And I think that's really important to understand that people really 50 and over, but especially 65 and older, are especially not just vulnerable to the flu, vulnerable to severe cases of the flu or even hospitalizations, but from a vaccination perspective, and this is something that our analysis really confirmed, is that they're the ones who can benefit the most from vaccination. So that where you see the strongest impact of vaccination rates in lower levels of hospitalizations and lower levels of mortality in cases. So undoubtedly, the older you are, the more impactful it is. And those are the groups that are impacted the most. In terms of how we came about it, there's, like Robert was just saying, there's a tremendous amount of data out there. And so a lot of it is really bringing the data together and getting the perspective that we need on it. And that's a lot of what we did. So the CDC has great data on flu hospitalizations, on incidence, on mortality, and they have that over 14 years. And they have that by age group. So we grabbed all of that data. And then there's academic literature out there where people have looked at, well, what's the cost on a per patient basis? So we could see, well, if you're sick in the hospital with the flu, what's your average cost, and what's the cost if you're severe, and what's the cost of different age groups. So we had all of that information as well. And then, of course, being economists, we couldn't help ourselves. It's not so essential to what we're doing, but there's important data on income and inflation so we can understand not just the medical costs, but the productivity impacts and the cost to the economy. So what we were then able to do is just apply all the cost data and the inflation data to the incidence data, and summing all of those together, we were able to estimate what the flu season costs were, which you said in total was for the 2023-2024 flu season, a total of $29 billion.
And you said that data is key for the study. You analyzed 14 seasons of data. So how did that approach help you separate the effect of vaccination from other factors, like severity of flu seasons, for example?
I mean, the severity of flu seasons, that's a very important issue. And to some extent, it's not possible to differentiate over the seasons. But what we were able to do is we were able to look at different age groups. And we were able to look at as the vaccination rates have changed, and they have been going down. So over this period, you saw an increase in vaccination rates, which was very encouraging. And then we've really seen a reduction, a very disconcerting reduction in those rates. And so that gave us great information by age group where we could look at what is the impact on hospitalizations? What's the impact on mortality when you have different levels of vaccination rates? And what we found is that for all age groups, and I think this is incredibly important, for all age groups, 18 and above, that higher vaccination reduces the risk of the worst possible outcomes. And that's mortality. And that's regardless of age. And I thought was very impactful. We were also able to look at 50 and over in particular, where you saw less hospitalizations. So it's not just mortality, but also severity of illness. And you were able to see that with those 15 and over. And so that's where a lot of the economic benefits also would come from in terms of reduced incidence and reduced hospitalizations. So we were able to really see the benefits of vaccines across the adult population, and revealing it was really important to look at it both by age demographic and over that long series of time so we could really see how that's worked through.
Thanks, Wayne. And all that data that you analyzed over the 14 years also allowed you to model an alternative scenario, right? And I think that's a big part of your study. So, Wayne, you're the economist in the room. When you looked at a scenario where 2023-2024 vaccination rates matched recent historical highs, what did that analysis show in terms of lives saved and dollars saved? And how confident should we be in those estimates?
Well, one, I think we should be very confident. We model the scenarios because we think it provides really great perspective. When you throw out just econometric data or statistical analyses, that doesn't bring it to kind of a human level, that doesn't bring it into a policy level. I think it's really important to kind of fully kind of get the perspective on what's happening, is to be able to see what do these relationships mean from kind of an actual kind of incidence and cost basis. And so that was really the purpose of the scenarios, was to show we have these relationships. So if we kind of go back and look at what things would have looked like in different vaccination rates, how would the costs have changed? How would the mortality have changed? And so when you look at the peak vaccination rates, which were much higher than what we saw in 23-24, you're still talking about, for the most part, vaccination rates that are too low. So from 18 to 49, you're talking about 38%. Only 38% were vaccinated. From 50 to 64, you got a bit more than half, 52%. And for those over 65, that is 75% vaccination rates. Those are the peak vaccination rates we saw between 2010 and 11 and 23-24. If you took those peak vaccination rates and you applied them to 23-24 with the relationship between vaccination and mortality and vaccination and hospitalizations, what you came up with is that you saw that there would have been 8,000 fewer influenza-related deaths had the vaccination rates been higher. had the vaccination rates been higher, you would have seen costs almost $3 billion lower, $2.9 billion lower, if we had had those higher vaccination rates. So you really see a substantial difference in the severity of the annual flu season had we just had vaccination rates that really, should be higher, but were the highest that we've seen over the past 14 years. I think it's quite astounding, and I think demonstrates the efficacy of the vaccines.
Let me address one issue, which I think Wayne addressed, is the 14-year levels of data. The more data you have over several years, the more it normalizes the benefits, because then you are not stuck with peaks and valleys of whether or not it's immunization rates or outcomes related to influenza. So that's why having long number of years of data year over year of flu seasons and influenza rates and vaccination rates and so on and so forth makes us more comfortable about some of the results that we got through the modeling. So that's also very important, that the longer, more data, more robust data you have, it removes the bias of maybe having a very high level of flu season one year versus a low levels of flu season another year, and also with vaccination rates.
And with the severity.
Well, thank you both. And so the benefits are clear. We can all agree on that. Yet vaccination rates remain quite low. So, Robert, the next question is for you. You also authored a companion white paper for the study, and it notes that adult vaccination rates remain inconsistent and below optimal levels, especially among working age adults. So, what are the biggest structural barriers that keep people from getting vaccinated? Access, trust, convenience, something else?
That's a great question. So, vaccination rates in the United States for adults have always been below expectations. This is not a function of this year or last year or year before. Year over year, you look at the data. If you look at the Healthy 2020 data, the Healthy 2030 data, especially with regards to flu, the immunization rates have been below par. That is not only for the senior population, which is below par, but not significantly, but patients 18 through 65. It's always been dismal. So why is that? That's a great question. I personally think, having dealt with patients when I've been in practice or family members, there's this lingering underestimation of what flu is and influenza is. People look at it as just, well, you're just going to get the flu, or it's a cold and you're going to have a little bit of fever or chills and you're going to get over it. They don't appreciate the severity of the illness, and they don't appreciate how it will impact patients' lives from a mortality, morbidity standpoint. And so the perception drives a lot of the immunization rates. They just don't think it's an important enough disease for them to get vaccinated. The other thing is that, frankly, there's a perception that the vaccines don't work because, well, you hear this over and over again. I got the vaccine, but I still got the flu. And that's partly because we don't do a good job of explaining why people should be vaccinated. People should be vaccinated for not only to avoiding the disease, but also to reducing the burden of illness and the severity of illness. So that's one of the other reasons why I believe that there's such difficulty getting people to buy into the immunization. So it's the perception of the disease not being severe enough that everybody gets a cold, and then that the vaccine really doesn't work, so why should I get it? And then there's issues like access barriers. A lot of times we create these artificial barriers. For example, we only allow immunization in certain settings that may not be conducive for adult patients who work on hourly wage earners to be able to get that immunization done. Or past policy positions that the government mandated vaccines for COVID and everything else, the perception and the lingering effect of those mandates still occur, and it drives down the behavior that we see currently with the population, which is distrust of the vaccines in general, and also that they don't believe that the government is telling them the truth. Anyways, it's not a single thing that's driving this low levels of immunization, but we've been dealing with this over the last decades as far as I've known regarding the study data that we've looked at.
Thank you, Robert. Well, in your white paper, you also take us from diagnosis to solutions. So you recommend changes like integrating vaccines into clinical workflows, using EHR prompts, electronic health record prompts, and better connecting health records generally with immunization registries. So if you had to pick one or two changes that would make the biggest difference tomorrow, what would they be?
Number one is clearly having a better educated patient population that we need to do that, and that has to happen through healthcare professionals being honest and forthright about what vaccines do and don't do, and creating this confidence within the population about what vaccines are. But if you want to look at specifically what you can do, look, majority of vaccination for adults today take place in a pharmacy, and connection of an EHR health record needs to be that the pharmacist should have access to that information or be integrated into the pharmacy workflow. One way you can do it, for example, because almost in every state, when pharmacists immunize patients, they have to report it to state registries. Perhaps doing the EHRs also comply or integrated with the vaccine registries in every state. So those are very specific things. But generally speaking, Ben, and we've talked about this ad nauseum on this podcast about immunization, is that we need to do a better job as healthcare professionals, me included, as a pharmacist, to be able to create this confidence about what the vaccines do and don't do for patients.
Now, another group that you both highlight is employers. You call on employers to play a bigger role, for example, by offering on-site clinics or partnering with pharmacies. So this question is really for the two of you, Robert and Wayne. From both a health and economic perspective, why should employers see vaccination as a workplace investment rather than just a benefit? Wayne, do you want to start?
And I think in our paper, right, we talked about in the 23-24 flu season, there was $13 billion in lost productivity. So it actually does impact kind of employers directly, because when the flu season is very bad, people miss work, and obviously that impacts them, but it impacts the companies. And Robert was just alluding to this, that if you bring the vaccination into the workplace, you're lowering kind of the barriers or the costs for people to get vaccinated, especially hourly workers. If you get paid by the hour, it's harder to go and spend 2-3 hours in the day to go and get vaccinated someplace else. If it's in the workplace, you're reducing those costs, so you're really going to be increasing the convenience and hopefully the vaccination rates by making that more convenient.
Ben, one of the things is that when you look at the loss of productivity, the big number, 13 billion, I venture to guess the impact is probably also much more severe for smaller employers. And the reason being is that I was talking to a reporter yesterday about this, and he asked me, why do I think that way? I said, well, think about it. If you're a small employer who employs about 10 people and one of your employees gets flu, that's 10% of your workforce that is going to be out potentially. And then forget about infecting the others. This whole notion that $13 billion is a large number, I think it impacts both large and small employers, but probably the severity of the impact on work productivity is probably much more significant in smaller employers, because there's nobody to replace you. If you work for a large corporation and you get the flu, yes, you miss time from work, there's loss of productivity, but there's always somebody to be able to replace you. When you go to a smaller employers where it's private companies and things like that, or not even companies, imagine like it's a restaurant, you can decimate your workforce in a single flu season by having everybody out, or even a large portion of your workforce out.
Well, thanks, Robert. And now let's bring this home at the policy level. So, Robert, if you had to boil this down to one message for federal and state policymakers, what should they prioritize first to reduce flu death, hospitalizations, and economic losses?
We need to increase vaccination rates. I mean, it's very clear, right? Vaccines save lives. They reduce hospitalizations as well, and they improve work productivity, save money, and everything else. So we need to improve vaccinations. How do we do that? There's several ways that we outline in our white paper that it's going to be in the show notes, and people can go and read about it. But we need to create vaccine confidence again. And we need to also explain to people why they should, as I said, get the immunization. Not because it's going to 100% prevent you from getting the flu, but guess what? It's going to prevent you from getting a severe case of the flu that's going to knock you out or potentially cause significant harm, including death. The other thing that we need to do is basically do a better promotion, and this was very clear in our study, of people 50 and older. This should be something that we push to our healthcare professionals, to our employers, to our public health officials, that this is a severe issue for especially that population. Remember, immunizations, Ben, always impact our most vulnerable. Who are our most vulnerable? It's elderly, generally 65 and older. In this case, you can argue that it's 50 and older for the flu, and also our youngest. And if you look at the data for the youngest, and with the changes that currently occur through the scheduling of vaccines for pediatric vaccines that's been announced by HHS, we're putting people at risk. And we need to do a better job of basically protecting our children, our youngest of the young, and our oldest populations, because they're the most vulnerable to these diseases.
Well, thanks, Robert. Thank you both. Lots of learnings in this episode. Wayne, thank you so much for your insights. And my main takeaway is that influenza isn't just a seasonal inconvenience. It's a predictable and preventable economic shock. The evidence shows that improving adult vaccination rates would save lives, reduce hospitalization or reduce hospital strain, and prevent billions of dollars in avoidable medical costs and lost productivity. The challenge now isn't science, it's implementation. But I'm not the expert, so Robert, you have the last word.
I think you said it best. It's not inconsequential, and it's not some disease that you're going to get over it no matter what. Everybody gets it. It's just basically a cold or something that you have no other option but to go through that disease. And that is the biggest takeaway to me, and the biggest thing for regards to education is that the severity of illness of flu is underestimated, and people believe that they're not going to really have bad outcomes by avoiding the flu vaccine. In addition, I think that we've talked about ad nauseum in this podcast is that, look, you want to get the vaccine not only to prevent the disease, but also to reduce the burden of disease.
Well, thanks for breaking that down for us, Robert. And again, you can find the link to the full study paper in the show notes. That's it for us. Don't forget to subscribe to our podcast on Apple Podcasts, Spotify, or wherever you might be listening, so you never miss an episode. And if you have a second, help spread the word by rating our podcast, writing a positive review, and sharing with your family and friends to help more people like you find us.
If you have any questions, thoughts, suggestions, comments, please get back to us through our email, which is podcasts@ghlf.org. You never know, we may include you in the next episode and have a discussion on one of those topics.
And before you go, make sure you take a listen to some of our other great podcasts on the GHLF Podcast Network. You can find all of GHLF's podcasts at ghlf.org/listen. He's Dr. Robert Popovian.
And he's Ben Blanc. Thank you for joining us our season 7, and we'll see you on our next episode.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.